This is Gil. Gil's been a patient of mine since 2005, and Gil is a 73-year-old male with a medical history of hypertension, high cholesterol, hallux rigidus surgery, bilateral hip arthroplasties, spine surgery, rotator cuff tearing, and trigger finger, who presents with complaints of bilateral knee arthritis. Gil has advanced osteoarthritis. It's tricompartmental, most notable at the lateral compartment, which is grade 4 advanced near bone on bone. Gil was scheduled for knee replacement surgery and elected to avoid it, and has been successful in holding off the surgery with hyaluronic acid injections every 6 months. Gil recently completed a series of 5 hyaluronic acid injections and is present today for PRP. So Gil, it is a medical procedure, and it's important to know anytime I stick a needle in your knee, the risk includes infection, fever, allergy, no relief, and worsened pain. We haven't seen that, but theoretically it is possible. You need to be aware of that.
Right.
Typically you want to ice and elevate for about 15 minutes at a time, and maybe do it 2 or 3 times this evening.
Got it.
And the beauty of the therapy is it's natural based. When people always ask, how much activity can I do and when? So in general, you want to take it easy the first couple days, which are we call the inflammation phase. And so we want that to subside to promote healing in the next phase. And so I want you to take it easy. It doesn't mean bed rest, but just relative rest. Don't go to the mall and do excessive walking. Don't do too much stair climbing. And in 2 to 3 days, you should at least return back to baseline, hopefully, and then gradually increase your activity as tolerating returning to your walks that you do for exercise. Ideally, I prefer you to avoid anti-inflammatories like Advil, even ibuprofen.
Okay.
We're going to give you a script for Vicodin for breakthrough pain. It's rarely used. I don't anticipate you'll need it. I prefer Tylenol that you take temporarily.
Okay.
We use the region kits, 2 region kits THTs. Just checking for a vein. 1, 2, 3. After drawing the blood, I invert the tubes 2 times to mix the sodium citrate to avoid clotting the blood. I'll take this off in about 10 minutes, okay?
Okay. Are we looking?
Perfect. Now we'll spin the blood at 3,400 RPMs for 9 minutes. After the centrifuge is done, I invert the tubes 5 times to mix the PRP. 3, 4, 5. Now it's ready to be drawn out. I connect the second transfer device into the syringe and plunge over the tube, holding the tube upside down and drawing the PRP into the syringe. I do this on both syringes. Now we're ready to inject.
So typically when we're injecting a knee, we use the ultrasound to ensure accurate needle placement. And there's different approaches to get into the joint. Typically what we'll do is we'll flex the knee at 30 degrees and look at the suprapatellar recess. In some patients, they have a patent bursa that's open and filled with fluid. In those cases, my favorite, we'll go in and aspirate. But in case like Gil, he has limited to no suprapatellar fusion or fluid. And so in this case, we're going to go medial infrapatellar approach. So now we're just cleaning the area, Gil. And then next you'll feel some icy cold freeze spray and then a poke. And again, in this case, Gil's elected to avoid lidocaine. He's done fine with all his hyaluronic acid injections. So next I'm going to give a little alcohol, Gil, a little cleaning solution. And here's some cold freeze spray. Okay, Gil, take a breath in. Exhale. You okay?
Yep.
So I'm just going to go nice and slow. You're going to see my needle tip in the upper left-hand corner. Doing all right, Gil? You may feel a little pressure here.
Yep.
And I'm just sliding right into that little synovial fluid pocket. And you feel a loss of resistance once you slide right in. And I'm going to inject. Doing okay, Gil?
Yep.
And you shouldn't feel much at all resistance. A nice flow. Okay, take a breath in. Exhale. Not too bad?
No.
Good.
No, it's good. No, it's fine.
Okay, so next I'm going to bend your knee a few times back and forth. So we've now changed sides of the table, and we're going to do the same approach, the medial infrapatellar approach on Gil's knee. And you're going to feel some cold freeze spray. Okay, I want you to take a breath in and exhale. You okay?
Yep.
Doing okay, Gil?
Yep.
You doing fine?
Yes.
Okay, girl, that's it. You did great. Thank you so
Okay.
much.
Let's do some work.
So now I'm going to bend your knee a few times,
Okay.
slowly back and forth with me. And this just helps spread it throughout your knee joint. So your knee can feel stiff and sore up for 2 or 3 days. Your knee has no idea you took blood from your arm, spun it, concentrated down several 100%, and then reintroduced it into an area that has no blood flow. So it can be stiff, sore. You're going to ice it as we talked about and elevate, and then activity is tolerated after a few days.
Okay, great.
Okay, great. You
Good.
did really well.
Thank you, Doc.
Okay, Gil, good luck. So
Yeah,
they're going to
thank
ice
you.
you down after this. You did awesome.
Okay, great.